Well, the U.S. is now averaging more than 124,000 new COVID-19 cases every day. That is the highest rate we have seen since early February, with nearly a third of eligible Americans still unvaccinated. Vaccine mandates are gaining momentum, with Citi just the latest to make their announcement saying all corporate employees must be vaccinated. Let's bring in Dr. Jonathan Javitt. He is the CEO of NRx. He's also an adjunct professor at Johns Hopkins School of Medicine. And we've got Yahoo Finance's Anjalee Khemlani joining in on the conversation as well. Dr. Javitt, it's great to talk to you. We should point out you're going to be ringing the closing bell at the NASDAQ today. So certainly a momentous day for the company. But let's talk about the broader picture right now as it relates to the coronavirus. To what extent do you think the surge that we're seeing from the Delta variant can be brought under control without vaccine mandates in place?
Well, thank you, Akiko. Thanks for inviting us back. The surge is, clearly threatening everything we've built in terms of herd immunity. There are still unvaccinated people who need to be vaccinated, but we're seeing breakthrough infections in people who've gotten good vaccination against the original COVID wild-type virus. Just last week, I was with the scientists at the Israel Institute for Biological Research, and one of those scientists, who was vaccinated twice with Pfizer, suffered an infection from the Delta variant.
Dr. Javitt, Anjalee here. Talking about the vaccines, I know that you're also working on one and you have tests. Tell me about the global sort of situation right now. I know that generally speaking, even some of the larger players have had struggles with manufacturing. What do you see for the projections going forward for the vaccine you're working on?
Well, manufacturing is clearly a problem, especially with synthesized vaccines. One advantage of working with a self-propagating live virus vaccine, where the virus itself is not believed to be at all harmful to human beings, is that the vaccine essentially makes itself. It doesn't package itself. You still do have a global shortage of glass, a global shortage of manufacturing sites to package vaccine, but the vaccine substance makes itself in a bioreactor if it's properly fed, properly managed, so that you can make large quantities of viral vector vaccines very quickly.
When we look at, how the market should be kind of looking at the way that this is going to be managed moving forward. I mean, we've been talking a lot about booster shots, and we've been talking a lot about breakthrough infections, but in those breakthrough infections for vaccinated individuals, it doesn't seem as if it results in maybe the need for drugs that help prevent respiratory failure. And I know you're working on one there. So talk to me about how maybe, the market stacks up in the needs right now as we continue to vaccinate the globe.
Well, anybody who thinks that people who are getting breakthrough infections are not going to the ICU should talk to an ICU doctor in Florida, Texas, a couple of other key states. The ICUs are filling very quickly. People most certainly are developing a need for therapeutics that will rescue them from respiratory failure that's being caused by breakthrough infections. So the notion that because you've been vaccinated and getting a breakthrough infection means that you are immune to developing respiratory failure and you're not going to wind up on a ventilator is simply untrue.
Dr. Javitt, looking ahead to Friday, we know that the CDC advisory panel is going to be meeting to discuss boosters, really a front of mind topic for a lot of people. What do you anticipate will be sort of the resolution to this, and how does that sort of set up the population when it comes to, another cycle of needing to get vaccinated?
Well, unfortunately, the only tool we have right now is boosters to the original first generation vaccine. And it's an important tool because it appears that resistance drops over 6 months from the original mRNA vaccine. So anything we can do to boost immunity, we need to do. The problem is the first generation vaccine has only partial coverage against the Delta variant. And when you look at the data that's still not really in front of the public, from the Lambda variant and other variants behind it, you're going to see less and less immunity from the first generation vaccine. So it's critical to have COVID therapeutics available for those people who get breakthrough infections. And it's critical to rush into well-controlled clinical trials with vaccine variants that may be more effective against the new variants that are threatening us than the first generation vaccines.
And doctor, there's been a lot of concern around the spike that we have seen in infections among kids. We saw that number nearly double last week. There seems to be still question about just how seriously children are affected, especially with those who are under 12 that aren't vaccinated. What's your read on what we're seeing so far, and how concerned should parents be?
Well, thank you, Akiko. My knowledge is not better than your knowledge on this, but there are clearly very, very worrisome reports coming from children's hospitals about children who are suddenly being hospitalized with the Delta variant, where we all know that the original wild type virus did not seem to be particularly threatening to children. So not only are children personally at risk for being infected by these new variants, but they're certainly increasingly placing their parents and their grandparents at risk as they bring these variants home.
Dr. Jonathan Javitt, CEO of NRx and Johns Hopkins School of Medicine adjunct professor. It's good to talk to you today, and our thanks to Anjalee Khemlani as well for joining in on the conversation.